Hello everyone, this is Mrs. Summer Labake, the Father of Labake organization. I'm here to pick my granddaughters up from school, and I'm like, you know what? I'm waiting. Let me use the few minutes to do my recording. I've been trying all day. I record, I delete, I record, I delete. So let me see what I can do now. So I'm bringing you a health talk, health information, so that we can promote wellness and prevent diseases. It's only a health talk. I'm not making diagnosis. I'm not doing anything else than just giving you health talk. When I finish, in case you have any of the signs and symptoms I'm going to be mentioning, please seek medical advice. Or if you have any question, you can email us, inbox us at labacare.org. So my topic for today is glaucoma or glaucoma. Glaucoma American, glaucoma British. No, glaucoma British, glaucoma America. So what is glaucoma? Glaucoma is a group of diseases that affect the eye due to damage to the optic nerve, which will thereby increase intraocular pressure, the pressure in your eye, and thereby leading to vision loss or blindness. So damage to the optic nerve, increase intraocular pressure, leading to vision loss or blindness. So what are optic nerves? Optic nerve, they are microfibers. They are tiny million fibers. They are grouped together and they relay messages from our eyes to our brain so that we can see. Without the optic nerves, we are going to be blind. With damage to the optic nerve, we are going to be blind. So what's the prevalence of glaucoma? In America, about 13 million people have glaucoma. That's in America. Worldwide, 675 persons are suffering from glaucoma. In the third world countries, we can't even mention third world countries. It's like everybody's having it, especially when we get older in the third world countries. There is genetic predisposition of glaucoma. In Nigeria, you see a family of 5. 3 people are suffering from glaucoma. Some of them are blind because there is no easy access to healthcare. They don't have money to go to the ophthalmologist, and most time it is sudden buildup of the pressure, and as a result, they have blindness. So what are the types of glaucoma? I'm going to be talking about 2 major types. We have open angle and we have close angle glaucoma. Open angle is gradual. There's no signs and symptoms. You won't even know you have it. So we can say silent cause of blindness. Open angle glaucoma, there's increase in intraocular pressure. The fluid does not build up. There is fluid buildup, but it's not as severe as in close angle glaucoma. That is, which means the fluid that is, between the cornea and the iris, because the eyes is constantly making fluids to function. So when there is fluid buildup, it stays in the front of the iris, and as a result, the pressure increases and the nerves are being damaged, and they're not relating. The optic nerve is not relating the messages from our eyes to our brain. That is the open angle glaucoma. So close angle glaucoma. Close angle could be chronic or acute. In acute close angle glaucoma, the angle between the iris and the cornea is closed because of buildup of fluid. Intraocular pressure rises, and as a result, there's blindness or decreased in visual field and visual acuity. So close angle glaucoma can be sudden. It has symptoms. Might be pain. There might be redness of the eye, severe headache, and may lead to inability to see in both or one eye. So that should be a medical emergency, and that should be something, that we have to take care of right away. So that's glaucoma. Now, what are the risk factors? Who are the people at more risk of having glaucoma? Anybody over age 40, you can have glaucoma, whether black, white, Hispanic, or Asian. Anybody over age 60, and also people who have history or family history of glaucoma, they are more likely to develop glaucoma. People who have diabetes, uncontrolled diabetes, they are more likely to have glaucoma. So I'm going to stop here. Then next week I'll come back, or maybe over the weekend on Saturday I may come back and talk about different signs and symptoms and what is our responsibility, what we should do in order to not have the complication from glaucoma. The glaucoma is not curable, but you can decrease the complication. You can limit the complication from having glaucoma. Thank you. Have a good day. Bye-bye. Mrs. Omalabake, the Father of Labake Organization. This is a Labake production. Bye-bye.